Choosing a form of contraceptive should not come at the risk of cancer. Around 60% of American women use some form of birth control. The intrauterine device has skyrocketed in popularity in the United States over the most recent decade. Over 4.4 million women use an IUD as a reversible contraceptive. The T-shaped device is directly inserted into the uterus to trigger an immune response, resulting in inflammation. Serving as a toxic environment, sperm cannot reach the fallopian tubes to fertilize an egg. There are two types of IUDs used by healthcare providers today: copper and levonorgestrel, otherwise known as hormonal. Other common forms of contraceptives include the pill, shots, implant, patch, vaginal ring, or other barrier methods. Following, researchers have identified associated risks with contraceptive use, making a connection between the pill and ovarian cancer. But what about the IUD? Does the device pose a potential risk to cancerous ovarian tumors? The IUD is unique because it is as popular in media as it is in medical discourse. Misinformation covered in the media has led to false conclusions, while researchers' results have been inconsistent and inconclusive. A recent study examines IUD use and the risk of invasive ovarian cancer using data from 3 population-based studies, finding a non-existent relationship between the two. Especially in the peak of IUD use, establishing this correlation is crucial when considering various methods of contraceptives. This study aims to bring clarity to a less established result, potentially presenting the IUD as a viable option for birth control. Published in the International Journal of Cancer in 2021, this study collects data from 3 different U.S.-based population studies, the New England Case Control Study, and 2 prospective cohort nurses' health studies. A team of researchers led by Jiaqi Yang, a professor at Harvard University School of Public Health, examined data regarding IUD use and ovarian cancer. Funded by the National Institute of Health, data collection consisted of 4 different sections of 5 years, spanned over 3 consecutive decades. Participants included in the study were primarily located in the Northeast United States. Ovarian cancer begins in mutated cells in the fallopian tubes, further multiplying and becoming cancerous. There are at least 15 oncogenes identified leading to ovarian cancer. However, ovarian cancer mortality has been on a decline in recent decades, largely due to the increase in oral contraceptive use. Other studies have been conducted regarding the IUD in relation to ovarian cancer. Some support the inverse relationship between duration of use and ovarian cancer, while others report a positive association. However, this connection has not been established, leaving the various IUD risks unclear. Researchers sought to assess the overall safety of IUDs and conducted the study to determine a clear conclusion. The following 3 datasets were compiled and analyzed to conduct the study with a very large sample size. The NEC portion of the study identified 2,323 women ages 18 to 80 with ovarian cancer in the designated area. The study contained 2,339 controls. Regarding the NHS and the NHS2 meta-analysis, a total of 223,554 women ages 25 to 55 were included. For both studies, detailed reports were taken on ovarian cancer diagnoses, including histotype, stage, and grade. Following, participants were inquired about IUD use such as duration, type, age at first use, and reproductive history. The effects of both copper and hormonal IUDs were also investigated in both respective studies. When IUD use was modeled in relation to ovarian cancer, no significant correlation was found. This applies to both copper and hormonal IUDs, as well as in respect to the duration of use. Researchers observed a minimal trend in the increased risk of ovarian cancer with older age at first IUD use, but the biological mechanisms supporting this trend are unclear. Nevertheless, no evidence was found to support the development of ovarian cancer in relation to IUD use. Results were consistent across all data, which is promising in the general discussion of IUD safety. A major strength of compiling 3 studies for data analysis is the extremely large sample size, validating the relationship between variables. Another crucial element of this study is its data analysis from over 3 consecutive decades. The duration illustrates the long-term effects of IUDs while still pertaining to devices manufactured today. The authors clearly outline the study's experience, limitations, and strengths, as well as the expected response to their research. Patient background can greatly influence health and bodily responses, so the lack of diversity in participants should be noted when interpreting the data. A variety of races and backgrounds should be included in future improvements of this study to generalize findings. Although not noted by the authors, survey-conducted research limits the study's flexibility and potentially the validity of responses. Despite these flaws, the study produced an ethical and valid claim. The findings of this study strongly support a non-existent relationship between ovarian cancer and IUD use. It is valuable to consider the IUD as an effective and relatively safe form of contraceptive. However, because the IUD was first introduced 55 years ago, much of the published information is outdated, which instigates skepticism on the device's effectiveness. There is room for further research to be done to encounter any remaining controversy. Birth control and contraceptives should not be a risky endeavor for women to protect themselves, and eliminating associated risks such as ovarian cancer may present the IUD as a viable and cost-effective option for birth control.